So moving ahead, we move on to the second fireside chat, and the topic for this is the dilemma of a large corporation, insurance or assurance model. Although we got an insight in the morning regarding Swasthya being such a successful model, having been tried both the insurance as well as the assurance model. So we are looking forward to this fireside chat. For this, I would like to invite on stage Mr. Arnab Chakravarti. He is Vice President, Human Resources, CESC Limited. A brief introduction about Sir. He's having a rich exposure in various portfolios like HR, IR, talent acquisition, change management at leadership level, and has successfully anchored his team and organization through difficult business scenarios and been instrumental in establishing benchmark HR processes. Mr. Chakravarti is presently the Vice President, Human Resource with MSCESC Limited, a part of the RP Sanjeev Goenka Group. He is presently the National Chairperson, Expert Committee on People Management, Bengal Chamber of Commerce and Industry. He is the President of XLRI Alumni Association, Kolkata Chapter. In the past, he's also remained President of NHRD, Kolkata Chapter. He joined the Indian Army in 1993, posted at various field and staff positions, including the Staff Selection Board as the GTO. He entered the corporate world in 2000 at ITC, managing critical roles, CNB, L&D, IR at their hotel divisions, corporate and new business development divisions. Post that, he had a stint in Reliance Corporate Headquarters, Mumbai, in talent management. He moved to Kolkata and was responsible to establish the Reliance retail business in Eastern India. Thereafter, he joined Spencer's Retail as country head talent management, and then the group transferred to CESC Limited. He's a postgraduate from XLRI and is a certified coach from Coaching Federation of India, certified at various HR tools like EQI, Predictive Index, Thomas Profiling, etc. He's presently the president of the Kolkata Alumni Association XLRI and a member of the CII HR Subcommittee Eastern Region, and is the immediate past president of the National HRD Network Kolkata Chapter. He has been honored as the most influential HR leader by the World HRD Congress in the year 2017. We welcome you, sir. Along with sir, we have a little bit change in the schedule which may have been given to you. We are having Dr. Vineet Sikka with us. He is Vice President, Group Head, Growth and Strategic Alliances, Apollo Hospitals. So, sir, I would like you to come on stage. So, Dr. Vineet Sikka is a Vice President and Group Head, Growth and Strategy Alliances at Apollo Hospitals Group, bringing over 18 years of diverse experience across hospitals, health tech and strategic growth. He leads Apollo Unified B2B strategy, driving partnerships and institutional businesses across corporates, insurers and public enterprises. Known for his blend of a strategic vision and operational excellence, Dr. Sikka is passionate about building value-driven, technology-enabled healthcare ecosystems that advance Apollo's mission of accessible and integrated healthcare for all. So, thank you, sir.
Thanks, Saurav. So, good afternoon, everyone. I think after lunch, this is the second session, but this topic is quite interesting. And we all talked about insurance penetration, and that needs to grow. But we still have this question in mind with a lot of large corporates and a lot of PSUs also, that do they want to go to insurance or they want to focus on a self-fund model? So that is where we are. We are sitting with Arnab. He heads the HR vertical of a large organization. And he also faces a similar situation as other HR leaders. So we'll take his opinion on how he thinks this works and between assurance and insurance. So Arnab, you want
Thanks. And I work with a company which is over 100 years old and which has approximately 10,000 people. And we have 20 doctors on our roll and about 25 places from where we give OPD services, apart from the factories that we have. And I was listening throughout the day, various speakers talked about gatekeeping model, about how profits could be made, a win-win model. But I was a bit dissatisfied since 3 words were not used: empathy, compassion, and how the human model would work. Because at the end of the day, the money that you are thinking of earning is based that body. So while Vineet and I were discussing about assurance or insurance, until unless either the assurance model or the insurance model has enough compassion and empathy in it, neither is going to work very successfully. So while I was saying I have 20 doctors and 25 places through which I give services, where most of us fail at the end of the service is a point where I stop showing empathy or compassion, and that is not through a fantastic model that you make in your table boards with discussion. It is that individual and that mindset which gives the last bit of service to people there. And handling 10,000 minds with at least 10 ideas in their head is a real difficulty. Now, how do you handle that is not exactly this versus that, but somewhere between we have to see a model which works in probably a hybrid mode.
So you're indicating towards a hybrid model. So what do you think? It's the IPD that should move towards insurance and OPD should remain self-funded, or you think like companies like Maruti or ITC is still sticking to a point where everything is self-funded rather than a hybrid model? So how do you compare IPD or OPD or overall towards insurance or self-funded? How do you see that?
See, any model or system that you should work is also you should be aware as to what people and why do people give medical service. The first is the welfare motive. And the second part is the compliance, like Factories Act and other act come into it. The third is compassion. And fourth is an emergent requirement. Now, either in the model, compassion, assurance or insurance, are you able to put in the entire composite factors into the models that you are working into it? So what I was trying to learn throughout the day, that if you do not include and understand the 4 cardinal principles as to why companies want to go either way, none of your models are going to work. The fact remains is, if I am giving OPD service, I'm talking about the company that I work in. So 25 places I am managing OPD services, and they are managed by an MBBS doctor, not an MD. Few of them are part-timers. So in that scenario, when that person who's an employee gets an medicine or is seen at the place of his work, he has an amount of satisfaction that the doctor who sees me is an employee like me, and therefore generally the trust of giving service may not be wrong. So will a third party be able to deliver that trust? That's a question that I leave to all of you. Whereas the other side is the hospitalization and other services. That partially and largely we have transferred to insurance. But also that is where sometimes the trouble is. The insurance covers a few things. Beyond that, the coverage is let go at where that person is sitting and the service which this person is receiving in, say, Kolkata. So that fellow tells him, this is it. Iske baad aur kuch pass nahi hoga. So imagine a person who probably has taken his father and probably not taking his father back alive also. He is also told that, well, this is it. So where do we fill that gap? That is what I'm trying to impress on all of you, that you can go into this model and that model, but where do you bridge that compassion model, where you don't have to just put on that axe and forget it?
Yeah, I think you're absolutely right. One more model that I could think of, maybe a third model here, is where some of the large enterprises are using is they do self-fund, but the claims and everything are managed or serviced by a TPA. That's another model where actually the payments are done directly to the providers by a company, similar to an insurance company, but the processing and everything, because they are those intelligent minds who will process the claim. That's another model. What do you think of that model?
See, the first thing that I come back to the original point is, like I was saying, we've got doctors, we've got pharmacists, we've got everything ready. But do you think that all my employees are satisfied? No. So, but again, they have that end of the day saying that this is my company, and therefore whatever treatment comes by, this is what comes to me. But imagine a third party giving you an OPD treatment. So he will first not be able to connect with that person sitting there. Okay. The second part of it is what service next, because most of us are now talking about a digital service. So how does that employee who's been used to a particular one-to-one service move to that digital service, and a doctor saying, okay, this is 10 a.m. to 10:30 your appointment, now I need to see the next patient. So whatever model you seep into in the OPD scenario, you must slowly ease the one that has been followed for a long period, see the viability of the other one, test it rather. Okay. Any human process needs to be tested for a period of time, and when you see the level of comfort has been reached, then switch over. Rather than immediately giving them a model, and then you have to close and withdraw that model.
No, we understand. So from OPD perspective, because we are talking about OPD right now, a lot of corporates or even PSUs are moving towards a technology platforms which are trying to save them from certain frauds, because reimbursement brings a lot of misuse also. A lot of people work in remote areas. In those remote areas, then you have smaller hospitals, or there is a chance of a fraud that comes through it. And a lot of people, a lot of corporates have moved towards that technology. What are your thoughts on that? Is that something that you're thinking would be a right model?
See, I won't deny that the present model that we are following has its own malpractices, has its own choices and hindrances in it. But again, most of you are doctors and from the medical areas. Everyone has a particular preference that the order goes to a particular medicine shop. You order a typical type of a medicine. You order from a particular company. So neutralization of, I would rather say, cartels of choices is something that you need to be very clear of when you go digital. Yeah. So when a person goes the digital way, I understand the choice is not his from where the medicine is coming. That's good for a company like us. But that habit of getting the choice has to slowly moved on by better service. And what can be the better service is that more people remain in contact with the employees. So if I am moving out a service from me to the third party should be able to take that responsibility and then be the partner of choice from my employee. So it should not be that I have hived off a part of my service to you and the responsibility remains with me. That's then trouble for me.
So representing a lot of insurance companies, even providers, I'll just ask a simple question then. What is it that you are willing to outsource? Is what you feel as a large enterprise?
See, we've been willing to outsource many things. Few, like the earlier times, it was a simple assurance model. Anyone goes to the hospital, anyone comes for an OPD treatment, everything taken care of. So slowly we realized that there is part of it that we cannot handle, because we are a power generating company, we're not a medical company. So we started leaving things. But one day, about 10 years ago, one of our IT specialists came down and said, I have a liver transplant. That's not covered by insurance. Then I was talking about that period. So we all looked at our faces and we assured him that we'll take care of it. Slowly, insurance companies started adapting to that scenario. And like silly little things, like you go for an eye treatment, the specs are not allowed. So that fellow comes back smiling to me, he says, is it such a big amount? So these are piddly little things that the insurance should slowly forget. And then a man is going for cancer treatment. To tell him this is it and this is not it is something that is a habit and nothing to do with the insurance company actually. It is what people are you recruiting to give service is more important. Because what they convey may not be what you want to convey.
Right. I think, I don't know if it is possible or not, but insurance plus a self-fund model, with a combination of both. I think I leave it to the forum and we all will discuss in future, but this is something that can be one of the models. I think corporates today have that buffer mechanism where they do cover some of the diseases, but I think formalizing it as a part of policy is something which is an interesting topic for future. But I just had one last curious questions on, you have a lot of medical doctors inside. They're all on your roles. So how easy and difficult is it's for you to manage, because this is completely, you are actually building a small hospital or a healthcare facility inside, and then how are you regulating it? What are the challenges that you face?
I have repeatedly said that I am a power generating company. And sometimes when you see 20 doctors, it's like a small clinic within a power generating company. So this is actually a trouble for me. But the fact is, if I move on to an alternate, will that solve my problem or create another problem? That's where it's not me, it's all the other companies also who are companies with 8, 10, 20,000 people. Because the broader the numbers, your aggregation of service becomes more difficult. So is the insurance company or the other aggregators, do they have the capacity to handle numbers? So I think it is more of an internal reflection that the insurance companies must, before coming into a model, must understand that do I have the capacity to handle 10,000 people? And then also handle 10,000 people. And suddenly I put up my hand, said, "Mere se to nahi hoga." The company to chodenge nahi aapko. That's where I draw the curtains and make you understand that taking on business is easier. But to sustainably run it with a human touch is where the rabbit wins over the horse. So slow and steady, not fast like a race ka ghora. That's where I tell whoever walks into me that human touch is more important than the money that you take off. Companies like us, ITC, would really not fight with you for premium, but we would fight with you for service, and that is where we have trouble.
Thank you so much, sir, for putting this across. Just a last message if you can give to all the HR leaders who are thinking right now on the next renewal. What are the 2 things that they have to keep in mind, whether to, if they are going towards insurance or self-fund? What is the last note or advice you can give them?
So I would, for all the HR people, if there are any, I would only see that before doing renewal, see that is the insurance contract flexible or not? Does that include something beyond the particular service that they are extending? Are you flexible enough to accept a little more addition, a little more service? And end of the day, who is handling the customer is very, very important for me. Because end of the day, a person who's very target oriented, God save your company, but the fact is, as a human-centric person, I am in human resource. Aggression is good for market, not for the human being. You can go for targets, but the person who handles us, we are not targets. We are human being. Handle us with compassion. That's my...
Thank you so much, sir. Thank you so much for all your wisdom here. I think it was very essential. Thank you, Saurav.
Thank you so much. It was indeed a very enlightening session and a lot of direct questions directly answered by sir also. Thank you so much, sir. Thank you, Vineet sir also. I request Sridevi ma'am to kindly come up on stage to felicitate both Dr. Vineet as well as Arnab sir. I think intentionally the post-lunch sessions have been kept in this way that people don't go off to sleep. It's been very interesting.